Hi guys, John Adamson, the Rehab and Documentation Guru. And today I just want to talk about strengthening of your patient. And for a lot of us physical therapists, one of the tests that we use for functional strength assessment is what's called the 30-second chair rise. Some of you may be more partial to the 5 repetition sit to stand. That is basically looking at the same thing. Obviously, the 30-second chair rise looks at how many repetitions somebody can do within 30 seconds, and then there's normative data based on age ranges for that. And then the 5 repetition sit to stand is looking at how long does that take for them to do, and then that looks at age normative data and significant change and things like that. So the question might be to you, how do you get to the patient who cannot perform a sit to stand without use of arms to a point where they can do a sit to stand without arms? Well, obviously for some patients this is not going to happen at all. But if you have a patient that's fairly uncomplicated and the only issue is strength, have you considered incorporating isometrics into your training? Obviously, the biggest problem people have is initiating the sit to stand. Because you think about it, at that point, the amount of torque that needs to be developed, the pull by the quads to initiate that stand is much higher than if the patient was already, let's say, at 45 degrees of elevation off the chair. They need much higher output from their muscle. Isometrics are by far the number one way to gain strength in a certain range. Generally, what studies have shown is that isometrics can help gain with overflow up to 20 degrees in either direction from the point at which you do the isometric. So you have them do a maximal contraction within that isometric range. Let's say it's 90 degrees of knee flexion, and you're isometrically contracting the quads. Then you should get carryover to 70 degrees and 110 degrees of flexion at the knee. So that you're strengthening at the 90 degree angle in an isometric contraction will have carryover at that much range either side. So with that said, you get better also muscular contraction. Motor recruitment is greater with an isometric contraction than any other type of contraction. And so you're trying to gain strength. The more motor units you can recruit, the better strength gaining effects. And so using isometrics for your patients is going to be a positive in terms of outcomes. You'll gain more quickly as well. Because a lot of strength also has to do with neuromuscular input rather than muscular hypertrophy. So we are retraining the nerves to recruit motor units faster and more strongly. That's why if you look at powerlifters versus bodybuilders, a bodybuilder's focus is on gaining as much muscle mass as possible. But then you'll have powerlifters who are smaller than them outperform them in lifts. Why is that? Because strength is in part related to how quickly and how effectively you can recruit the actual motor units. And so sometimes the gains of strength can happen without significant muscle size increase. So going back to what I was saying initially, sometimes we need the patients to function in a certain range functionally that they cannot do right now, like the 30-second chair rise if they cannot arise. By incorporating isometrics into your program at that range, not only will you get them to possibly initiate the movement better, but you will get carryover within ranges above and below that. Anyway, just a little exercise tip. John Adamson, the Rehab and Documentation Guru, wishing you a pleasant day. Take care and God bless.